Right, welcome everyone to the latest installment of CADGA's Research into Action webinar series. My name is Nicole Sands. I'm an analyst on the evaluation and research team at CADGA. And the purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. In today's webinar, we're delighted to have Dr. Jeffrey Mena, RN, PhD, join us for this very exciting presentation on findings from his recent article, Exploring Art-Based Interventions for Youth Substance Use Prevention, a Scoping Review of Literature, published in BMC Public Health. Dr. Mena is an associate professor at the Prince Albert campus of the College of Nursing at the University of Saskatchewan, Canada. His program of research focuses on interventions with an emphasis on HIV prevention and care, that is on harm reduction, stigma reduction, and peer interventions, both locally and globally, improving outcomes for clients and families affected by addiction and promoting immigrant health. He uses diverse community-based research methodologies that employ qualitative research methods, such as art-based methods, and methodologies that honor lived experiences, such as patient-oriented research. He teaches perspectives of nursing in a global context, mental health and addiction nursing courses, and therapeutic interventions for individuals and groups in an undergraduate program and nursing research in the graduate program. He's also actively involved in supervising master's and doctoral students in mental health and addiction thesis projects. Now I'll turn it over to Dr. Mena.
Okay, so thank you everyone for coming. I'm gonna share my screen. Let me see. Okay, so thank you very much for coming to this webinar. And thank you, Nicole, for inviting me to be part of this conversation. So for today, we will be sharing the findings of the scoping review that we did. And as you can see from the title, we're calling it Exploring Art-Based Interventions for Youth Substance Use Prevention, a scoping review of literature. So I was the primary author, but I also have other colleagues that also authored in this publication. So, so in terms of the objective, so in a way, I want to provide some bit of history about as to how this project came about. And specifically, so I'll just be looking at the genesis and the context of the work, but also we'll be talking about the impact of how COVID really changed the original intention and how opportunities came about to imagine new possibilities. And then, of course, we'll be talking about the process of the scoping review and what the findings can do in terms of the informing policies and practices. So let's begin by locating where Prince Albert is. So Prince Albert, Saskatchewan is actually based, as you can see there, that little map mark thingy. So it's in the western provinces. We have about 35,000 people. So I just put this map here for you to be able to see where we are. So we are not as a big city, like perhaps some of the cities that you come from. We are actually that biggest city in Saskatchewan. Saskatchewan is a very big province, as you can see from the map, but we only have 1.2 billion people. So we're a fairly scattered population. And so then this is the actual map of our city. The photo of the city is not as clear as it ought to be, but it kind of gives you a sense of who we are and where we are. But I think in terms of the ethnic composition, and you're going to see why that's important, the 40% of the population self-identify as indigenous, and often it's called the gateway to the north because north of Prince Albert, there's no major city. So a lot of indigenous communities that surround us actually use Prince Albert as a place to come and receive social services. And so we think that we cater for about a catchment of about 100,000 also people. And so sometimes it can be a very busy place, even though we have a small population. The catchment area tends to be quite significant. And so another important significance of Prince Albert, before it was settled by Central School of European descent, it used to be a meeting place for many indigenous communities. And so it still holds a very special place for the many indigenous communities that surround it. So in the same vein, we cannot talk about Prince Albert without really talking about the indigenous people and the legacies of colonization. And so this is a photo of the that is a reminder of what a lot of indigenous population experienced. So historically, in 1876, the government of Canada passed what is infamously called the Indian Act. And the whole idea was to assimilate the indigenous people into the dominant culture. And so with this registration, it created a framework for the establishment of a residential school. And this is one of the residential schools that was established. And the significance was is that it led to a lot of declining or decrease in practice of indigenous languages and culture. And people who attended these residential schools were forcibly separated from their families and experienced diverse forms of violence and the many cultural disruptions that was caused by the attending of residential schools. It hindered their reintegration when they came back to the community. And so a lot of conversation have happened that have culminated to calling the act of the government cultural genocide, because it dislocated the children from their families as they tried to assimilate them to the main population. And then, of course, the prohibition of cultural practices and language robbed them of their cultural identity. And so as the trauma that they experience from attending residential schools has been deemed as a significant risk factor for the development of many mental health and addiction issues, as you're going to see in this slide. So indigenous population in Canada are significantly impacted by mental health and addiction issues. Almost every statistics you look at, you'll be able to appreciate how devastating addiction and mental health issues are to the indigenous population. Like, for instance, look at the statistics about that 25% of all the problems with substance use and addiction issues tend to affect indigenous people compared to the 70% of the general population. And if you look at the children themselves, you'll see that the children aged 9 to 12, youth have a higher prevalence of substance use compared to non-indigenous youth. And again, you also see another statistics, they're more likely to experience, 13 times more likely to experience opiate overdoses, fatalities, compared to non-indigenous people addicted to opiates. This was statistics that was taken in British Columbia in Canada. And so, and then of course, another significant statistic that kind of gives us a sense of the impact of addictions on indigenous population is looking at the HIV infection. And so among the indigenous population, they have double the national average. And the main risk for indigenous of HIV infection is actually injection drug use, which of course is a major issue that we see here in our province. So in addition to the statistics that impact the indigenous population, again, we also not very fortunate when it comes to the local statistics of the general population. Now, our city of Prince Albert has a high per capita consumption of alcohol, which is 1.5 times the national average. And so within our city as well, and this is not just for the indigenous population, this is for everyone, 73.8% of youth consume alcohol compared to 62.2% of the national average. And so, of course, you see even things like binge drinking among the youth is 20% higher than the national average. And then, of course, we get to see the impact of that in terms of the number of people who get to be admitted in the emergency rooms of the hospital and being admitted to the hospital as a result of addiction-related illness is very significant. And so, and again, there are many. So the major thing that we get to see is a straining of the public resources, whether it's policing resources, whether it's healthcare resources. Like, for instance, just to pulling out the recent statistics that we have, you see only 23 patients between 2015 and 2016, they spent a combined 668 days in acute care. And a very few of them actually completed treatment. So, and if you know about Canada, is that we are a public funded system, meaning that people don't get to pay for the healthcare is paid for by the provincial government. So you can imagine the number of the resources that are being devoted to 23 people that would have others been used to provide care to other people. So we do see a lot of straining to the healthcare system as a result of substance use and addiction that is very hard to manage and treat. So we did talk about the statistics about the youth. I'm not going to repeat that. But I think we also began to see, as we were doing some other research, is that a lot of the children here, they begin to get exposed to substance use at a very young age. So you see that children as early as 6 years old, they have a history of being exposed to alcohol, marijuana, and then all the way up to 11 years old, we begin to see children being exposed to opiates, cocaine, and methamphetamine. So clearly, you see when the children are being exposed to substances at such an early age, then you can imagine by the time they need to come for care, they have been using substances for a longer period of time. And then, of course, we get to see then that's spilling over into schools. So, like for instance, about 76% of cases that would be brought up to the hub, and this used to be a kind of a multi-agency organization that would try and figure out how to best support individuals in this region, children in this region, and they found that more than 76% of the cases that would be brought for consideration at the hub actually were because of missing schools, 47% because of mental health issues, and alcohol directly 59% and drugs 52%. And then, of course, all of these things, they feed into each other, because a child who is growing up in an environment where the parents are struggling with substance use is not likely to be concentrating in school, so they're likely to drop out of school. So whether it's school going, whether it's mental health issues, whether it's use of drugs, all of them have a significant impact on the children themselves. And of course, the fact that they have been exposed to these substances at a very young age, so they are even not able to function well in school when they go to school. And so again, you can see another statistics also that affect the youth is 10% of the youth that would be held in police would be because of intoxication. So again, you can see those are school-going children that are being apprehended. Rather than thinking that they ought to be in school, they are struggling with substance use at a very young age. And such individuals, about that 7% of them would miss close to 90 to 100% of their classes because of alcohol-related police involvement. So again, you can actually see this is a very dire statistics. This is a very dire situation that the youth in this region are facing. And so as we began to think about what we can do, I guess the philosophy that was guiding our thinking around is that if there's any hope to break the vicious cycle of addiction, I guess the only hope that we might have is actually working with the youth, because in some ways they represent a bridge between the past and the hope for the future. And so typical to what we do as community-based researcher, because this is what I do, when we began to pay attention to these statistics, so we thought of bringing the community together to really talk about what's going on. And so I organized an event which was called the Prince Albert They Want, the State We Want. And basically, we just want to talk about what's happening with as far as the issues of substance use and addictions are concerned. And so we brought together about 60 people. And so this is a photo that we took. And people are very open to really talking about what is ailing their communities. And substance use and addiction was a major issue that people have wrestled. And this is not something that is new. This has been a chronic issue that has bedeviled the community for many, many, many years. And complex as it is, it's very difficult to imagine of any simple solution that can comprehensively address the issues that the community is facing. And so we had a very robust conversation about what the community thought that needed to happen. And as true to being a community-based researcher, we took the voices of the community members themselves and we endeavored to publish them. And so we had a nice publication that was well received, just describing, not really having fancy terminologies that sometimes scholars were known for, but a very plain language kind of manuscript that really talked about what really transpired and somehow communicating the hopes and aspirations of the community. And so among the many funding opportunities and ideas that came out of that, we felt very strongly that we wanted to give a youth a voice. And so we went ahead and we put together a team of community members, as well as the researchers and people who are affected by addiction. And so we put together a team and we thought, well, why don't we start hearing from the youth? Because if you look at the photo that I had just shown you in the community event, you are not going to see any youth. And so the idea was that if you really want to understand the issues that the youth are facing about substance use and addiction, you better start hearing the voices of the youth, because oftentimes it's easy for them to be neglected. It's also easy for them to be overlooked because we assume that, well, the professionals are the experts and their voices really matter. But if you're truly faithful to being a community-based researcher, then you have to do the hard work. And the hard work is engaging the youth in the conversations and ensuring that their voices are being put up front and they're being heard at the decision-making table. And so we put together a team, as I said, and we applied for a grant which called Engaging and Empowering the Youth at Risk of Alcohol and Drug Use in Prince Albert and Art-Based Interventions. And so we wanted to bring out the voices through the art. And one of the things that we wanted them to do is that we wanted them to use the cameras, which of course we know what Photo Voice is about, which is where you engage the youth or any participants, you ask them to go and take the photos of an idea of which is of interest to them, a phenomenon of interest to them. They make a choice as to what that phenomenon looks like, and then they ascribe meaning to it. And so for this particular situation, we wanted to set them out, and we wanted to communicate to the community in Prince Albert the risk that they see and the vulnerabilities that they see that put them at the risk of developing alcohol and drug use disorders or dependencies. And then that, once they take those photos, they will have sessions in which they would exhibit those photos. But at the same time, we also wanted them to also take photos of hope that would communicate alternative lifestyles that they hope for themselves. So in some ways, we wanted to help the community understand that the youth is acutely aware of the risk that they face, but they're also very much conscious of the fact that they also desire a better lifestyle. And so we were to give them the journals so that as they took the photos, then they would keep on recording their thoughts, so that then it's very easy for them to start to come and reflect upon them when the time came. And so again, with the exhibit, we were intending to print all the photos. And then for each photos, we were supposed to have a captioning down there that really describes what the photo is and the meaning that has been given by the youth. And then we would invite as many members of the community, stakeholders, to come and witness the exhibit. And through that exhibit, then we would be able to generate community conversations as to what they think should happen to support the youth so that they can move forward as engaged stakeholders in substance use and addiction prevention. So even though those are the intentions that we had, and we had gotten funding, and we had identified the community that we wanted to implement, and we had already supplied them with the cameras, then all of a sudden, COVID happened. And when COVID happened, then we had to change the conversations, because at that point, as you can remember, in 2020, every part of the society was shutting down. And so it was thought that it was not a wise idea to have the youth go into the community and take photos. And so because we didn't know when the COVID will be over, and we didn't want to sit on the funding, we decided to change the direction a little bit. And so we sought permission to try and carry out a project that was similar to the objectives of the community-based research. And so when we got the funding, the permission, we decided to conduct a research on the exploring the art-based interventions for youth. And so, but at this point, we decided to expand the thought and the idea, because Photo Voice is just one of the many art-based methodologies that we had hoped to do. And so, because it's one of the many art-based methodologies, we open ourselves up to say, well, if you're choosing to do a scoping review, we may as well open ourselves up to really understand the other art-based methodologies that perhaps have been used and what we can learn from them in terms of being conduit or agent for substance use prevention. And so what we consider as art, anything that's photographic, in poetic language, sculpture, painting, craft, music, dance, anything that is art in and of itself, which of course is quite broad, is what we thought that we wanted to consider. And then of course, we still wanted to maintain the end goal, which was to present our findings to the community stakeholders. And so when we consider art, we were very conscious of the fact that it can be a therapeutic medium that can actually be used to promote and prevent and promote recovery, and more importantly, to empower the affected individuals to voice their concerns. So I think we are quite excited that although we were unable to be able to carry out our original research idea, that somehow through the scoping review, we could be able to do something that was very close and very similar, and somehow still be able to meet the objectives of the original research project. And so I'm sure you know what a scoping review is, but basically it's a scoping review is a type of review that is really meant to determine the scope of the body of a topic. So to what extent has a particular topic been researched? And so when you do a scoping review, basically what you're trying to do, you want to really understand the volume of the available literature and the overview of it. So we really don't want to appraise. The idea is not to really appraise the quality of the research that have been conducted, but you want to look at how much of it is there, how much has been published, and then once we get hold of all the materials that have been published, and then we can begin to figure out the types of available evidences in that field. And as we do that, then we can start clarifying different concepts. Like for instance, when we think about art-based methods, we can begin to think about how have different people conceptualized or conceived the concept of an art as a vehicle for engaging in substance use prevention. And of course, you know, as we also interact with the materials that we are going to do the literature search on, then we are able to begin to figure out the characteristics or the factors that are related to a concept. And for most part, if people want to proceed further to appraise the quality of the material that they are putting together, then they can put together a systematic review. So for most part, a scoping review can give an opportunity, because when you do a scoping review and you figure out that you have enough materials to work with, then you can actually be able to commission a scoping review that allows you to appraise the quality of that materials in that field. And so, again, it also provides an opportunity to identify and analyze the knowledge gaps that are out there. And so there are a couple of steps that you engage, because scoping review is a very systematic methodology. And so the first thing that you need to do is to identify a research question. So again, as I said, this was a plan B. We didn't want to do it. We never set to ourselves to do that, but out of necessity, we chose to go that direction. And so we set ourselves to answer this question, 3 questions. Number 1 is that what is known about art-based interventions that are aimed at preventing youth substance use? And number 2, what are the characteristics and study outcomes of those interventions? And so, and then number 3 is, could we be able to identify any perceived effectiveness of these interventions? And so once we all agreed as a team that these are the worthwhile questions to ask, then we went to step 2, which is to looking at the relevant studies. And so we would use keywords such as art-based youth substance use interventions and prevention. And working alongside a librarian, we searched a couple of databases, and we hope that we are exhaustive. ERIC, Medline, CINAR, Embase, Web of Science, and PsycInfo. And then, of course, we decided to have an inclusion criteria, because you can't have any such that the outcome that comes that you're going to include it. And so we wanted to really focus on interventions that specifically focus on the youth, because our interest was with the youth. We also wanted to look at the studies that had a clearly defined intervention. In terms of the target, we were hoping that we can be able to identify studies that are looking at that window of 12 to 17 years, and of course, written in English. So of course, we did the other steps, which is article selection. So once we conduct the search, then we imported them into Lion, which is a database that is a platform, that is used to select and to sort out the articles, but double branding, where 2 people are sorting out and agreeing as to whether to include them or not. And then, of course, once we were able to identify the articles that we're working with, then we went on to chart the data. Then we corrected and summarized, and then, of course, we reported the results. And so, in a way of kind of summarizing, this is what we ended up with. So again, as you can see, there's a Prisma diagram. We started with 6,770 articles. And then after we did all the screening and inclusion criteria, subjecting them to inclusion criteria, we ended up with the 19 articles. So for this manuscript under consideration, we are talking about the findings of 19 articles. So with regards to how we process, I just put this table here as a way in which to kind of just show how we try to summarize. And then once we summarize the articles using some of these subheadings, like you have the article, you have the purpose, you have the type of intervention. Like you can see, this one was about the drama and acting. And then, of course, we look at whether there's any other adjunct non-art-based interventions, because we really wanted to see, was there any accompanying supportive intervention as well that went alongside with the actual art-based interventions. And of course, looking at the extent to which the youth were involved and what kind of outcome they were able to record. So again, when we started thinking about how we wanted to frame the findings, we chose to call them themes. And so in some ways you can call them themes or categories, but so we really wanted to talk about what was the intention of the intervention, what was the idea behind. And so there are a couple of things that we found that to be very fascinating. And one of the things that we found was interesting is that there was the idea that there was a need for the youth to have the knowledge, in hope that if they have the knowledge, then they can change their attitude and perhaps change their practices. And so, and what kind of vehicles or what kind of agencies do they use to do that? And so in some ways they would provide life skills training. Like for instance, if somebody is living in an environment or a community where substance is being used, and so that's their community, how do they manage to navigate those kind of environment? And we are talking about intra and interpersonal skills. What kind of skills do those people need to have or to possess so that they can be able to navigate in an environment where perhaps substance use and addiction is endemic and still be able to survive or overcome the urge to capitulate and start using substances? And another key component of that was assertiveness, that presenting them with an opportunity or the risk itself, and which means is that you have somebody in a community setting or in a classroom situation actually giving you a substance. How do you behave if somebody gives you a substance and, hey, young man, do you want to try out this? It's going to make you feel cool. And then, of course, they were interested in giving them the tangible tools that they can be able to use to navigate those kind of risks. And really is one of the many interventions that have been used where you refuse, and then you explain, you avoid, and then you leave. So again, you can actually see within that particular piece of teaching them how to navigate the landscape where substance might be present, but more importantly also helping them to act in the event that they are being provided with an opportunity to engage in substance use, then they could have a takeaway skills that they can be able to use not only for that moment, but also for a lifetime. Again, there are also different types of impartation where they would now educate people about the substance themselves. So you see the differences between the first and the second. The first one is just about the generalities of, substances are in the community, you need to do something about it. But then number two, about the impartation of knowledge, we began to see that they endeavored to communicate with the communities about actually what substances do, both short-term and long-term impact of substance use. And also, they also endeavored to educate them about the regulations surrounding substance use, like for instance, drinking and driving. And so they'll look at the policies or the regulations for each and every jurisdiction and try to educate them about, you actually cannot do certain things when you're using substances. So I guess within that framework is helping them to appreciate that the personal impact of using substances and how that it may affect the way you engage with the world around you. And then, of course, the aim would also go on towards helping them increase efficiency to withstand the pressure to use substances, which of course is tied in with the assertiveness aspect as well. But I think much more importantly also, I think we also did see there was a real emphasis on cultural identities and being aware of who you are. And particularly within the framework of where people might be challenged to think about that by capitulating to using substances, particularly under peer pressure, that they are wanting to belong, and a sense of belonging is within a particular grouping of people, peer pressure is more important. But when we really ground the youth and to be sure and certain of who they are, that in and of itself can actually be protective. And of course, helping the youth to become critical thinkers about the choices they make. And so when you look at all those themes, you're really helping the youth to become active participants in the substance use prevention process. So again, it communicates the idea that there's a trust here, the youth are able and they can engage in substance use prevention practices once they're given the right tools. So, and then of course, the other theme or category that we looked at, we're also very interested to see how are they communicating the knowledge and the skills, and how are they helping? And so we did see quite a lot of videos and live performances. And of course, we didn't delve into analyzing the why, but again, you can understand the visuals, that the visuals have more impact. And the people are actually seeing people who look like them, people who behave like them, performing, they're likely to have more impact. And I think maybe this might be very close to what we now see as influencers. You know, the reason as to why we have in social media, for instance, just to use us as an example of influencers who are able to influence people of their generation. And so you can see the idea being also tapped into that as well, where when they begin to see themselves represented in the people who are performing, in the people who are engaged in the videos, then they're able to identify with those people. And then, of course, attending to the stories of resistance and people who have lived experiences, so learning from them, whether it's musical docudramas and of course, art group videos as well, enactment by professionals. Again, those are some of the things that they'll be able to see very close to them as people engage in different types of arts, as well as people engaging in role plays that would promote responsible drinking. So all different type of vehicles. So there's no one size that fits all. And one of the things that would see is that the choice of the intervention that a particular researcher used was very much informed by the characteristics of the population in question. So even though we have put this list of the types of intervention that were used, it was not haphazard. There was a thought that had gone into it in them determining the kind of the intervention that's appropriate for that population. And so another thing that we were interested to look at, in what ways were these interventions perceived to be effective? Again, this is not a systematic review, so we are not really critiquing the quality of the interventions. We are not looking at the degree of change for it necessarily, but we just wanted to understand, did they think that the interventions was effective or not? And one of the things that made those interventions that we talked about to be impactful, number one was aesthetic appeal, meaning that it has to be something that's appealing to the eye or the cognition of the youth themselves. So whatever it is that people choose to do, it has to be something that is relatable, something that the youth can be able to identify with, and something that the youth can engage with. Again, we see youth being actively engaged and involved. And then the other piece too that was key to the perceived effectiveness was the idea that it's being relevant and being relatable. So what that means that the stories that are being told, the exemplars that are being used, the type of substances that are being used, have to be things that the youth in that community can be able to relate to. So let's say, for instance, if a particular community has an alcohol endemicity or endemic to alcohol use, bringing stuff, say like marijuana, which is not a major problem in the community, is not going to be seen as something that was relevant. So when that meant is that the people who are carrying out those interventions had to have done their homework properly and sufficiently so that they can be able to figure out what's going to be relatable to the youth. And that could have meant that even before they did this kind of study, that they could have piloted the interventions to see whether it's working before now they can be able to implement it at a larger scale. Another thing that was very important was the idea of the structure. And the structure meaning that it's something that is well organized, that is cohesive, and something that, you know, it has a clear thought, methodology, or plan of action that moves them from point A to point B. And then, of course, another piece that we've talked about is the idea that anything that gives the youth the skills they can hang on to, that allows them to change their attitude, that empowers the youth, those are the skills that are going to remain with the youth even after the project is over. We know a lot of research grants, they don't stay there forever. So we have to be thinking about, particularly so when we are engaging with community-based research, to what extent are there going to be residual skills or materials that the youth can be able to hang on to that can be able to last beyond the life of the project. And of course, active youth engagement. Just like we believed at the beginning, we did see a very strong sense that the youth did not want to be passive participants. They didn't want to be told. They wanted to be in the mix of it. They wanted to be actively involved. And so anything that affects the youth has to ensure that the youth are at the center of it. And then, of course, the last one is incorporating cultural element. And so the idea is that culture, as we know, is protective against practices such as substance use. And so how do we help the youth, wherever they are, from whichever cultural community they come from, to be properly grounded in their culture, to be assured of who they are, so that they're not lost in trying to figure out who they are in this place and in that time. And so briefly about the discussion again, we did see, and maybe there's something that I may have repeated, in the sense of saying that there was a huge sense that a lot of manuscripts that we reviewed, the intention was not only to change the perception, but also to give them the skills that could use in real life situation in a way that will help them reduce the potential harm of substance use. And so, of course, you can think about the behavioral change. And so, as we know, if any of you are to use a CBT framework, we know that behavioral change requires people to know about something. And then once they know about something, they can shift their attitudes. And then, of course, maybe along the way, then they can start feeling differently about how now that they know about that information, in hope that then they can start forming new behaviors. And so, of course, another piece that was very key that perhaps we may not have really emphasized in the previous slides is that substance use and addiction does not happen in isolation. There are other things that needs to also to be understood and to be integrated. In addition to the context, the whole idea of mental health. And so a lot of successful interventions, they were not only careful to ensure that the interventions that they put, that they implemented to the youth, they also incorporated elements of mental health. So it's the right in terms of the developmental stage, but also at the same time, the one that also had mental health, because we do understand the impact of concurrent disorders, where mental health and addiction, they seem to go and kind of feed into each other. And so, of course, another piece that's also very important is meaning making. And we do understand behaviorally at developmental stages of the youth, anything that's going to grab their attention has to be something that's very meaningful to them. And so how do we create meaning? And how do you create space so that the youth themselves can be able to come forward to share their perspectives and to feel as though that their perspectives is being recognized and appreciated? And then, of course, having media action-oriented, visual that had appeal to both the cognition and affect was very important. So another piece that we also did see that was very critical is how the delivery was done. So I think in addition to having a solid content, the how in terms of the delivery is very important. And so we did see that the different modalities ensured that it was done in a very relaxing, fun, and helpful manner, but it did not take away the very essence of what the researchers wanted to communicate, whether it's paying attention to context, whether it's paying attention to relevance, whether ensuring that it was relatable, whether it's to make sure that it was culturally appropriate and meeting the right experiences. They made sure that the youth would find it to be very relaxing. And of course, the videos provide a very effective intervention as an educational or instructional tool. So again, we talked about active engagement of the youth. So I think this is something that we see over and over, and I think we really emphasize that piece. Just like our original idea, where we wanted to engage in photo voice, we were very gratified to actually see that the different types of art-based methodologies were actually putting the youth at the center. And this active engagement of the youth in whichever art-based intervention that there was ensured that whatever it is that was being done was relatable and relevant to their population. And then, of course, because they were using community resources, these interventions are actually manageable. And I can dare also say that these interventions would most likely have been seen to also be sustainable. Because if you look at the type of interventions that we talked about, these are the interventions that once they're implemented, they can be able to be carried on with relative ease into the community. And so, of course, being able to be replicated. The reasons as to why we do these kind of things is because we want to understand as to whether can some of the strategies that are utilized in particular contexts, can they be replicated somewhere else? And so we could see that the studies that we paid attention to, that we analyzed, would actually be possible to actually replicate, especially if you're very mindful that their context might be different from our context. However, understanding our context, understanding the content of our substances that we are wrestling with, and then picking up a strategy that might be appropriate for that population is the way to go. So you don't always have to reinvent the wheel. When you're looking at this kind of work, you just need to be mindful of those three pieces: content, context, and then of course the strategy. So as we wrap up this presentation, we always wonder about what lessons can be learned, because I'm assuming that people who are on this call may not always have the time to conduct a scoping review, because a good scoping review takes about 6 or so months, 6 to 9 months. It's very resource intensive because you have to hire research assistants, you have to consult the librarian, and then you have to put all the pieces together. And so we always like to have some ideas that we can leave behind for people to be able to take away with them. And so we are thinking about, having done all this work, what are the takeaways that we can be able to take home with? And so we have a couple, and number one is, if you have to work with the youth on an issue that is sensitive and stigmatizing as substance use and addiction, number one, you have to be mindful of the content and the context, meaning that you have to be very clear on what substance you want to address. Is it alcohol? Is it marijuana? Is it opiates? Is it cocaine? You can't be a jack of all trades and assume that you're going to be effective. And then, what is the context by which the youth are living out their lives? Because contexts vary from one place to another, and a country like as diverse as the United States of America or even Canada, the context, they differ. So the challenges that the youth in East Coast are going to have are going to be very different from the challenges that the youth in West Coast are going to have. Number two, you need to figure out what is the age that you're looking at, and ensuring that the strategies that you're going to use, the content of the materials that you're going to develop, is appropriate for the developmental age of that youth. But more importantly also, the youth must feel that the language that you're going to use is something they can relate with. The strategies that you're going to use is something they can be able to identify with. And when all is said and done, when the dust has settled, can they be able to have something they can be able to hang on to and take away with them to apply in real life? And at the same time, will the youth feel that they have been empowered to be able to carry on and can be able to deal and confront with any substance use risk that's going to come their way? And then, of course, ultimately, we don't want to create robots. We want to create youth that can think for themselves, youth that can solve problems, and who can be able to identify and mitigate risks so that they don't follow through the same cycle that perhaps their family members or relatives have seen themselves wrestling with. So in conclusion, we started with a journey of just talking about how we so much wanted to hear the voices of the youth in our community, educating us about the risks that they see and what opportunities they see for themselves as an alternative to the kind of a lifestyle they have seen their relatives, their community members live. But because we were not able to do that, we still were able, in somehow different way, engage in a study that would still help us tell a similar story. Our original intention was thoughtful, and so is with the studies that we included in the scoping review. And so we see that if you are to use an art as a vehicle for substance use prevention, it has to be appealing to the thought, to the emotion, and being able to be a vehicle that can be able to propel the youth to action. Again, I've talked quite a bit in length, of course, emphasizing about the setting and the character of the community. And in this one, includes, but not exclusive to, the idea of culture and prevalence of that substance. Of course, cultural sensitivity is very critical, and I think all of us will understand about how important it is to understand the culture by which we are trying to engage in. And so being able to infuse the cultural norms, the trends, the way they use our language is going to make sure that we're not offensive, even as we are trying to address something as sensitive as substance use and addiction. Of course, relatability is important. And then, of course, we have really talked about active involvement. And what we've actually seen, and not just with the scoping review, but also generally speaking, when you involve a community in community-based research, that the community members themselves, they take the ownership of the process and the outcome. So if you are to engage with this kind of work, then you must start be thinking about how can you make sure that the youth themselves see themselves as active stakeholders and owners, and having the agency to drive the process and to take ownership of the outcome. And then, of course, the aesthetics. This is kind of the icing on the cake, aesthetics and interaction stimulating. Having considered all those pieces, then, of course, you have to make sure that if you want the youth to remain in the program, then they have to be stimulated intellectually. So in terms of the limitations, this is something that you always have to talk about because no study is ever perfect. And so as you can see, we did not go out of our way to assess the quality of the study. So because our interest was just to understand the scope of this topic, so we didn't go beyond the description aspect of it. Another thing that you see is that we only got articles published in English. I'm sure there are many other articles that could have been published in other languages, but because we're only proficient in English, we have that limitation. And even with the best of the intentions, sometimes our search strategies can fail us. And so there could be articles out there that we ought to have included, that because of our search strategies that perhaps we were never able to bring it. So as I end this slide and conversation, it's just to think about that, having done all this kind of work that lasted us about 6 to 9 or even close to 1 year, how can this work be used, particularly for people who don't have the time to be able to engage in a similar work? Number one is program implementation. So we have done the difficult work of identifying different types of programs. And so one of the things that somebody in an organization can be able to do is to have access to this publication, because it's an open access, and look through the list of all the articles and of the programs that are included, go through them, and maybe perhaps pick one of the programs that they would like to adapt. And then, of course, they go through the process of cultural adaptation. Another thing that perhaps can happen is where we use the findings of these studies to spark conversations. Maybe you're working with youth, and you can use, because the language used in the manuscript is very straightforward. You can say, well, let's just sit down, let's have a reading group or cafe, and let's see what we can be able to get out of it. And the good thing is that when we present these findings to our community, we can still get the original conversation, because we want to get the community talking. We want them to tell us about what they think is important. We want them to tell us about how they see themselves being empowered to be able to carry similar research project or intervention projects for their own communities. And then, of course, for those of us who still have the time and we have commitments in academia, it can become a basis by which we can be able to appraise the quality of the findings, and of course, we do a systematic review. So I would say, in a nutshell, that's kind of my presentation, and those are the references that I used to prepare this presentation. Thank you very much for listening to me.
Thank you so much, Dr. Mena, and for your time and for presenting. Let me pull up. We're going to start question and answers now. So I'll start the Q&A session with a few questions of my own, and then we'll hear from participants. So our first question, stage 6 of Arksey and O'Malley's methodological framework for conducting a scoping study is consulting. You mentioned you would present your findings to community partners and stakeholders. Who have you presented your findings to so far, and who would you want to reach?
Okay, so I would say that the plan is to find a receptive community. Again, because this is one of the many projects that we do. So when we completed it, we've been looking for a receptive community, and we're still trying to engage with the communities that would be interested in doing this kind of work. So the plan is to identify a community that might be receptive, and then organize a sharing event And then once we have the sharing event, then we ask them to choose an intervention that best resonates with them. And then with that, then we can be able to attract more funding. So we are still in the process of engaging communities, and it takes quite a bit of time building community support and rapport and relationship, but we're very hopeful that sooner than later that we can be able to find that community, and then we can still do the same process of engaging community-based research strategy.
Okay. Our second question, now post-COVID, are you and your colleagues working on a systematic review, or do you have plans to continue the research you initially intended to do? And if so, has your approach changed since this review?
So we are very excited because of the possibilities that this work has brought about. And in particular, we are looking at other ways in which we can be able to break the cycle. Because if you look at the presentation that I made, you can actually see that we're in a very solid state where there's a vicious cycle of addiction. So we've been having conversation about which is the best place where we can be able to do an interventions around breaking the cycle of addiction, and youth is one of the places where we feel that we can be able to do that. But at the same time, we also are seeing other opportunities as well that we want to integrate, and in particular, looking at the whole family itself and how addiction is affecting families. So we've got a lot of opportunities that have come our way in the last couple of months to do it more holistically and look at particularly the current idea that we have right now is working with parents who are co-parenting with a partner who has a substance use disorder, and it's kind of just using the findings as a way to educate the community about the impact of addiction on families themselves. So I would say that although we have not done a scoping review, a systematic review to build upon it, but we are opening ourselves up to the many opportunities that are coming our way. But we feel very strongly that putting the family at the center might be another way in which we can be able to help break the cycle of substance use and addiction in our community.
Yeah, that's great. And then you mentioned how your work can be used. Specifically, how can coalitions and substance use preventionists in the field best use the findings from your research? So these are not only professionals in the public health field, but also teachers, parents, students, and other community leaders.
Yeah. So I would say the first step, I think, is for any person who cares about their community is to begin to recognize that substance use among the youth is a problem. That's number one. And then after that, then offer themselves to be champions of change. And then, of course, using this publication can actually be a starting point, but there need to be a champion. And then after that, then you can bring together the community of interest. And then that community of interest can actually start the conversation about, well, we have found this publication that is talking about different ways in which the interventions were developed to address substance use and addiction risks among the youth. Let's go through it. Let's see what we can come out of it. And then out of that, then we can begin to talk about, is there any of the publications that have been showcased that can be used in our community? Is there anyone that we can be able to relate with? And then once they begin to identify one that can be able to relate with, then they're in a better position to actually now start identifying other stakeholders, whether researchers, policymakers, or even decision makers, to put together to say, well, we have found this particular study that was conducted in a particular place, and I'm very curious as to whether this is something that our community can do or should do. So I think using the findings to spark conversation can actually be a way in which this kind of conversation can start taking place. And the community can use this as an example to inspire them to say, well, if people can be able to do something like this, then people can be able to employ that. And a good example quickly perhaps is to think about if they think that drama is or acting is one of the ways in which messaging on substance use can be done, then that also open themselves up, start collaborating with, say, local high school or even universities, which can be able to develop those kind of programs. So it gives us an opportunity to bring communities together when you're utilizing this kind of publication as a resource.
Mm-hmm. Thank you. All right, so now we're going to move into participant questions. So please type any questions you have into the Q&A box on the bottom of your Zoom screen. And we'll get to as many questions as we can. It looks like we do have a question. I don't know if you can see it on your end, Dr. Mena, but it says, does your funding have the capacity to support this research beyond Canada?
What I could say is that, we didn't necessarily there are opportunities to, if there are people coming together to work alongside each other, there's possibilities that grants can be applied for to do work globally. So yes, so there are opportunities, but it's, you will be competing like with the domestic applicants, but the opportunities to apply for grants, which if somebody had an interest to do this kind of work somewhere else, then it's very much possible to be able to put together a team and to apply for grants. But there's no guarantee that one will be funded, as we know. There's always a risk that that you're competing with other people. But with having said that, that still doesn't mean that we cannot be able to apply for such grants. So yeah, so there are opportunities to do that, but it's a process.
So we'll keep moving forward. And to wrap up, we do want to mention that the next Research in Action is already scheduled for December 12th. So mark your calendars and watch your emails for the registration link around mid-November. And as mentioned earlier, we will send a follow-up email with the presentation recording, links, a copy of the slides, article links, and a short evaluation. So please fill out the evaluation if you would like a letter of participation. You can view and download it from the thank you page at the end of the survey. And if you fill it out, to get the letter, you must download it right after you fill it out because you will not be able to go back to that thank you page later. So thank you, Dr. Mena, from myself and from CADGA for the wonderful presentation. I truly enjoyed hearing about your findings, and thank you in advance to all the webinar participants for your comments and questions, and we'll see you next time.